Thank you to everyone here today for your tireless support of Medicare for All. I am so proud to fight alongside you in this struggle, not only as the chair of the Congressional Progressive Caucus and the lead sponsor of the Medicare for All Act, but as someone fully committed to finally guaranteeing healthcare as a human right. Everyone in and nobody out. We are gathered at a time in which our country struggles to crush the most devastating health crisis in recent history. More than 612,000 deaths, more than 34 million cases, more people losing their health care because they lost their job, and more people losing sleep as they stay awake worried about their medical debt. The virus certainly made things worse, but our cruel, for-profit, broken healthcare system is to blame. And now more than ever, we need to guarantee healthcare for everyone with no copays, no deductibles, and no premiums, with primary care, vision, dental, mental health, prescriptions, reproductive care, and long-term supports and services. We needed Medicare for All yesterday when nearly 100 million people were uninsured or underinsured in the richest nation on the planet, when grandparents were sitting at the kitchen table cutting their pills in half, when parents were choosing between taking their kid to the doctor and paying the rent, when you were putting off the care you needed and the care you deserved. And some of our fellow organizers can't even be here marching with the movement today because of that very cruelty of our healthcare system. So our movement must march on for them. As the leader of Medicare for All in the House of Representatives, I am inspired by the activists here and those in the streets across the country. Thank you to all of you. We have made historic strides towards health justice and Medicare for All in recent years, and I was so proud to introduce the Medicare for All Act of 2021 alongside more than half of the House Democratic Caucus, including more than a dozen powerful committee chairs. It's thanks to your advocacy and your pressure that we continue to add more members each month. This landmark legislation is also endorsed by over 300 local, state, and national organizations that represent nurses, doctors, unions, and racial justice organizations. All of you have made all of that possible. As good organizers, you're not slowing down. You're calling for next steps to make Medicare for All a reality. And as a lifelong organizer who served as the National Health Policy Chair for Bernie's presidential campaign, I'm with you all the way. We will soon hold hearings in the powerful House Energy and Commerce and Ways and Means committees to demonstrate to members of Congress and the public just how crucial Medicare for All is. These hearings will build our legislative record and represent the next step in pushing Medicare for All forward. I look forward to using that platform to amplify our message that healthcare is a human right. These hearings will pave the way to make Medicare for All a reality. The path ahead is tough as we battle well-funded campaigns that are bankrolled by the very big pharma and health insurance corporations who profit off our pain. I know that it can sometimes feel like we're pushing boulders up mountains. But know this, we have made incredible progress. Part of that progress is on display today as activists in over 50 different cities march for Medicare for All. And while we make our case to those in Congress, we are also winning the argument in the public. Medicare for All is popular, and we're going to continue building the movement to make it the law of the land. The inside and outside organizing to pass Medicare for All works. It is powerful, necessary, and urgent. So keep marching and know that I will be right alongside you every step of the way. Together, we can win Medicare for All. Together, we can create a just health system. And together, we can guarantee healthcare as a human right to everyone.